House Speaker Nancy Pelosi is trying to avoid a direct vote on the Senate bill, and she may have found a way to do it. The House would pass the popular fixes to the Senate bill and, quote, deem that the Senate bill had already passed and incorporated in the rule without an actual roll call vote. The idea is already generating cries of outrage from Republicans who call it a gimmick. Democrats say it has been used before. Here with us now is Democratic Congresswoman Debbie Wasserman Schultz. Great to see you, Congresswoman.
Good to see you too, Andrew.
Let's talk about this. This would seem to indicate that she doesn't have a great deal of confidence that she can get to 216 votes. If she thought she had a majority, she wouldn't need to do this sort of by the back door.
No, this isn't a back door. This is really just a routine procedure used to pass legislation so that we can get our business done. When the Republicans were in charge the last time in 2005, 2006, the procedure was used 36 times by them. So this is a routine procedure used commonly in the legislative process, and it's nothing unusual other than trying to get our work done.
Well, it may be routine for routine measures, and certainly for things like passing the debt ceiling, something that nobody really wants to go on record on. But this is more than a routine measure, and all along she's been saying 216 votes. Suddenly, when we get down to it, when we're told that the Democratic supporters of health reform are 10, 12, 15 votes shy, now all of a sudden in the final days she's talking about doing this. It does seem like a last-minute option.
No, like I said, it's a pretty routine procedure. We have a lot of work to get done, and the Senate bill has passed the Senate with 60 votes. We've passed a very comprehensive House bill with 220 votes. We have an opportunity to make some changes to that Senate bill through reconciliation, and this is not something unusual. We actually are in the process of whipping this bill, and feel pretty confident that when we get to the vote, we'll have the 216 votes that we need.
Except that the Senate bill that was passed by the Senate is very different from the bill that the House passed. And so you would not be officially on record with the actual recorded vote. It would be perhaps incorporated into a Rules Committee vote, a procedural vote, but you would not be going on the record to, say aye or nay to the Senate bill.
Andrew, but keep in mind, the Senate bill itself is not the final product. We're going to pass a reconciliation bill to make changes to the Senate bill. So essentially, the Senate bill would go to the president, we pass the reconciliation measures, and that's how we complete the final product. So the fact that we're going to include the Senate bill as part of the rule is really a manifestation of the fact that that is not the final product. The additions to the bill with the reconciliation provisions is what the final product is.
Let me share with you some data, some new results from the NBC News Wall Street Journal poll.
Sure.
And the results are that people, when questioned, say that they are less likely to back their member of Congress if they support the bill by 36 to 28. Then when asked about the impact if people vote to defeat the bill, they say they are less likely to back them in November, 34 to 31 if they vote to defeat it. Basically, these are pollsters, Peter Hart and Neil McIntosh, are saying this is basically telling members of Congress there's no place to hide here. There's no safe way, either voting for it or against it.
Well, the good news for the American people is that we don't make decisions based on polling data, and polling data changes all the time. The polling that has consistently come out of that is on the components of our bill, which includes making sure that insurance companies can't drop you or deny you coverage for a pre-existing condition or when you get sick. Make sure that we get rid of lifetime and annual caps. Make sure that young adults can stay on their parents' insurance until they're 26. Closes the donut hole. Those provisions, all of which take effect immediately, they poll very high in the 60s, 70s, and 80s. So when we pass this bill, the American people are going to get the health care that they deserve, the cost control that they deserve, and the stability and security that they deserve.
Congresswoman, I'm not going to debate whether or not members of Congress react to polls. Maybe you don't, but maybe the 434 other members do. But I do want to share.
You're giving me poll numbers, Andrea, and then sort of suggesting why would members not listen to those polls. We listen to our constituents, and we were elected to do what we think is right. And I think the majority of the members of Congress believe that what's right is to pass health care reform so that we can do all the things I just said, bring some cost control, a lot of cost control, security and stability for those who have insurance, especially small business owners who are facing skyrocketing insurance premiums, and also covering the 47 million Americans that don't have it.
Well,
that's what we're trying to accomplish.
One pollster the White House is listening to is the president's pollster, Joel Benenson, and he's got a new memo out which says that independents' concerns about health care reform are not about specific provisions in the bills passed by the Senate or House, but instead reflect concerns about reform stagnation and all the backroom deal cutting. And just wondering whether this deem and pass procedure or the slaughter procedure, or whatever you want to call it, whether that will fuel the fire among independents who are concerned about the procedures, about the way this is all taken place.
Look, at the end of the day, I really believe that we really believe that what matters to the American people is getting cost controls in place, making sure that we can get everybody covered, so that we get rid of the $1,000 per family annual hidden tax that everybody pays to cover the uninsured, and make sure that we can provide that security and stability. I mean, Angie, I've got small business owners in my district who come up to me all the time. One as recently as 2 weeks ago, who face upwards of 172% premium increases because they have one sick employee. That stuff has to end, and that's what this bill will accomplish. And the procedure and process and sausage making that the legislative process is, it's never pretty. People complain about it, but at the end of the day, the substance of the bill is what they're going to be supportive of.
Okay, Congresswoman, thank you very much.
Thank
you.
you.
Good to see you.
You too.